The internet is full of bro science, fake knowledge, half information, or propaganda. Your quest of reliable, authentic health information ends here. So subscribe this channel and hit the bell icon, and you never have to go anywhere else ever again.
Hello everyone, how are you today? I'm Dr. Paramjeet and you're watching Dr. Education. Welcome back to my channel. As you know, we make videos about health and healthcare topics, and all our videos are directly referenced from the internationally accepted US National Medical Library, so you can trust the information. Today we are going to talk about pre-eclampsia, high blood pressure in pregnancy. Why it happens, how it happens, what are the causes, what should you do, what is the treatment, and what you need to know about it, right? It's very important for every young woman to know about this problem. It's extremely important. Make sure don't miss this and don't forget to share it. Let's start. So pre-eclampsia or pregnancy induced hypertension is a problem where during pregnancy your blood pressure rises and there are signs of liver or kidney damage that occur in a woman after 20th week of pregnancy, 20 weeks of pregnancy, right? So it is rare, but pre-eclampsia can also occur in a woman after delivering the baby, right? So if that happens, it most often occurs within 48 hours, right? That is called postpartum pre-eclampsia, postpartum, right? So what are the causes of pre-eclampsia and what exactly happens? What is the risk? See, pre-eclampsia, if it happens, it basically is the contraction of the blood vessels going to the placenta, and placenta is the main source of nutrition to the baby from you, and this can actually hamper the nutrition going to the baby and cause problems in a long time, right? So the exact cause of pre-eclampsia, to be frankly, cannot be pinpointed, but it occurs in 7 to 3% of pregnancy, and there are so many conditions which factors which can lead to pre-eclampsia, right? First of all, there might be a blood vessel problem. Your diet may be an issue, your genes may be an issue, you might have autoimmune disease which might be the issue and which might predispose you to pre-eclampsia. Other risk factors, like if you're having a first pregnancy, if you have a past history of pre-eclampsia, if you have multiple pregnancy, a family history of pre-eclampsia in your family, if you have obesity, if you are getting pregnant after the age of 35, or if you have a history of diabetes, kidney disease, or high blood pressure, then you have high chances of pre-eclampsia. Now, what are the symptoms? Most often, remember, women who have pre-eclampsia do not feel sick. They don't feel sick, but symptoms can happen, and symptoms include just swelling of the hands, face and eyes. That is edema, right? Swelling in your hands, face and eyes, and sudden weight gain over 1 to 2 days for more than 2 pounds, for more than a kg, 1 kg over maybe suddenly, right? Or maybe 1 kg, 2 kgs over a week, right? You have to know that some swelling on the feet and ankles is absolutely normal during pregnancy, but not in the hands and face and eyes, right? In the feet, it's normal because your uterus, heavy uterus, is pressing on the inferior vena cava, the blood vessels coming which are bringing the blood from your legs, and because of that pressure, some swelling can happen in your ankles and feet, but not in your hands, face and eyes, right? So that's what you need to look for. And if the symptoms persist, then severe cases of pre-eclampsia can have headaches which will not go away or become worse. They can have trouble breathing, they can have a belly pain on the right side below the ribs, and they might have pain on the shoulder. They might confuse it with heartburn, gallbladder, or stomach pain, or even some people can get confused that it is the baby who is kicking, right? And they might have urinary problems where they might not urinate very often. They might get nausea and vomiting, which is actually a very worrisome sign in this later stage of pregnancy. Then they can have vision changes. They can have temporary blindness, flashes, lights spot sensitivity to lights, they can have blurry vision, right? High blood pressure can be very tricky. They can even have lightheadedness or faint sometimes. So severe preeclampsia, severe pregnancy induced hypertension is not good at all. So how it is diagnosed? See, number one, obviously when you go to a doctor, your physical examination history is taken and your blood pressure is taken, and most often the blood pressure is higher than 140/90, 140 systolic, diastolic 90. Swelling can be seen in your hands and face, right? Remember, leg swelling can be normal. Weight gain can be seen. Then blood and urine tests are done. Blood tests, we can see what we do. What we see in urine, we check for proteins, right? We can see liver enzymes for liver damage. If you have proteins in urine, proteinuria or higher liver enzymes, then it might be an indication of internal liver and kidney damage. Platelet count can be low, and creatinine level may go high, again signifying kidney damage. Then tests can also be done to see how well your blood clots, and obviously you need to monitor your baby's health, right? Baby's health can be monitored by pregnancy ultrasound, non-stress tests, and these tests will actually help along with other tests to decide whether your baby needs to be delivered right away or not. Yes, if pregnancy induced hypertension is getting out of control, the best option is to get the baby out if it's safe for both of them, right? So a woman who has had a low blood pressure in the start of pregnancy followed by a significant rise of blood pressure needs to be watched very closely for the signs of preeclampsia. It's very important. Lastly, what is the treatment? Preeclampsia often resolves after the baby is born, right, and the placenta is delivered. So that is one thing, but it may persist even after it may persist or even begin after delivery, like I said before. So that is one possibility, but mostly it just goes away after delivery. So most often at 37 weeks, right, your baby is delivered, right, because it's developed enough to be healthy outside the womb. So if you have preeclampsia and you are 37 plus weeks, you can just go for the delivery, cesarean section or induced labor. So your doctor will give you some medicines to trigger your labor, or they might do a C-section, right? Or if your baby is not fully developed, in that case your doctor might give you some medicines, or they can actually help you manage your problems at home. The frequent doctor visits will be done to check whether your baby is doing well or not. Medicines will be given to lower your blood pressure if needed. Severe preeclampsia cases can actually go down very quickly. That changes the severity can change very quickly, and you very much need regular follow-ups, right? So complete bed rest is actually no longer recommended in such cases, but sometime pregnant woman with preeclampsia is admitted to the hospital, and this will allow the doctors to keep a keen watch on the baby and the mother more closely, right? In the hospital, they monitor your baby's heart rate, their activity. Medicines are given to control the blood pressure and prevent other complications of preeclampsia, including seizures, right? Yes, you can get seizures, which will actually be a part of eclampsia, right? The next complication of this problem. Then sometimes steroid injections are given for pregnancies which are under 34 weeks of gestation to help speed up the development of baby's lungs so that the baby can actually be delivered, right? So you and your doctor have to be in very close sync during this time to actually manage your baby, and a lot of things matter: how close you are from your date, how much severity is there of preeclampsia, what is your blood pressure, how well is the baby doing in the womb, right? Obviously your baby must be delivered if there is any sign of severe preeclampsia, like if your tests show that your baby is not growing well or not getting enough blood or oxygen, is under distress, right? Even if your blood pressure is your bottom number, the diastolic blood pressure is higher than 110 mm of Hg or greater than 100 mm of Hg consistently for more than 24 hours. If you have abnormal liver function tests, abnormal headaches, a lot of pain, seizures, right, that is a sign of eclampsia. If you have fluid building in the lungs, in the mother's lungs, that can be a sign of breathing difficulty, right, and the low platelet count or bleeding or low urine output, all these are signs that it's time to get the baby out as soon as possible. Remember, this condition can only be managed if you get help at a proper time. So perinatal, prenatal visits are very important. Regularly health checkups during pregnancy is very, very important, right? So this is all about pre-eclampsia. I hope this video is helpful, right? And don't forget to share this video. I'm Dr. Paramjeet. You're watching Dr. Education. Stay connected and stay healthy.